Okay, good morning, ladies and gentlemen. My name is Athikhun Praditpapha from Faculty of Dentistry, Chulalongkorn University. Today, I would like to present you the research Thai dentists concern on COVID-19 infection from dental treatment and daily activities and the related factors. Okay. Back in 2020, the first wave of COVID-19 outbreak in Thailand started in March. Although the number of infected cases per day was not high compared to the recent situation in Thailand, but people were so alert about the situation back then, and the government locked down in many areas of the country. In most cases, patients with COVID-19 infection will have no symptom even when they are ready to spread the disease. So it's very important to wear a mask as you don't know whether you or the people around you already have the virus inside the body. However, patient visiting dental professionals have to put down their mask in order to receive a treatment, and dentist work are always involved contacting with patients' oral and respiratory secretions, which are the main reservoir of the virus. Thus, it's unarguable that dental professional can be one of the riskiest carriers to contract the disease. For example, high-speed cutting instruments and ultrasonic scaler can create huge amounts of aerosols and droplets throughout the treatment process. The aerosols spread through the air around the treatment room until they enter a new host or settle down on the surface, waiting for other patients or healthcare workers to touch them. Many dental treatment guidelines recommend postponing of elective dental procedures and perform only emergency and urgency treatment that produce no aerosols or droplets. Also, the treatment should be done under effective infection control measures. However, some limitations might prevent dental personnel from following these guidelines. These limitations include the availability of personal protective equipment or PPE, safety of the working environment, the prevalence of the disease in each area, and the policy of each working place. So it is suspicious that which one do Thai dentists concern the most of contracting the disease from? Their work or their daily activities? This question leads us to our objectives. First, we want to compare Thai dentists' concern on COVID-19 infection sources between dental treatment and daily activities. Second, we aim to explore the associated factors of this concern as well. Now, let's talk about material and methods. Our study was designed to be a cross-sectional descriptive study, questionnaire-based. The study population were Thai dentists who were actively practicing in Thailand before COVID-19 pandemic. The sample size was calculated using this formula. After calculation, the sample size needed in our study was 381. Here are our inclusion and exclusion criteria. Inclusion criteria are Thai dentists who were actively doing dental practice in Thailand before the pandemic time point, who can read, write, and communicate in Thai language fluently. Exclusion criteria are responses from non-dentist respondents, incompletely filled questionnaires, and duplicated responses. The questionnaire used in this study comprised 3 sections. The first section is demographic and work-related data. The second part is concern of COVID-19 infection sources. This section comprises of 2 numerical rating scale questions. The respondents must answer these questions in terms of score ranging from 0 to 10. 1 zeros mean not worried at all, 1 means least worried, and 10 means worried the most. The first question is, you are worried that you will get infected with COVID-19 from daily activities such as buying food, goods, or traveling to work. And the second question is, you are worried that you will get infected with COVID-19 from performing dental treatment. And the third part is open-end question asking about the thing that made the respondents unhappy the most, and the respondents' opinion about the pandemic. We built the questionnaire using Google Forms, so the questionnaire can be distributed to a large number of respondents in a very short time, and the data collected will be stored automatically in digital form. After that, we distribute a link to the questionnaire via some private Facebook group and live group of Thai dentists. The questionnaire was open for participation during April 22 till May 5, 2020. Here are the results. There were 622 respondents answered the questionnaire. Of these responses, 5 did not pass inclusion criteria. 5 were duplicated answers, and 32 were not completely filled. Thus, there were 580 responses left for data analysis. Now, let's see the first section, demographic and work-related data. The table on the left is showing demographic data and the right is showing work-related data. Here we can see that most respondents were women, aged less than 50. Most were working in government hospital. 40% had secondary job as a freelance, and 1/3 had no secondary job. Dentists working in Bangkok were in a comparable number to dentists working outside of Bangkok. The next section is the most important part of our study, the concern of COVID-19 infection sources. This table tells us 2 important things about our study. We can see that mean score of the second question was significantly higher than the first question. This means that Thai dental professionals were more afraid of contracting the disease from giving dental treatment than doing daily activities. And in each question, female reported higher mean score than male did. So female were more concerned of contracting the disease than male, regardless of the source of infection. We also did univariate analysis between other predictors as well and concern level of infection source. The only factor we found having association with the level of concern was age. You can see in this table that age had a negative correlation with score in both questions. This means that older dentists were less concerned of contracting the disease from both daily activities and dental treatment. Now we arrive at the last section, the open-end section. For the question about what made Thai dentists unhappy the most during COVID-19 lockdown, top 3 issues mentioned were income, finance, or economy issues, working and further studying, and spread of disease. When asking about their opinion about COVID-19, the answers were varied. 199 dentists reported no opinion to this question. Of the 381 remaining answers, most reported neutral opinion or feeling, such as understanding the nature of the situation or suggesting a rational management rather than totally positive or negative aspect. Now, let's discuss about these results. As Thai dentists were more concerned of contracting COVID-19 disease from dental treatment rather than doing daily activities. This finding emphasized that they need improvement in their working environment to ensure their safety upon duty. At the time of the survey, having insufficient PPE and scientific knowledge of the virus might be the main cause of the concern, but these 2 factors would improve upon course of the pandemic and could possibly lowering concern of infection, both from daily activities and clinical practice in the future. We also found that female dentists were having higher concern of contracting the disease from both daily and clinical activities than male dentists. This finding was in line with many studies. For example, a study on risk perception of COVID-19 across many countries showed higher perception of the risk perception of the disease in female. A systematic review about the impact of epidemics and pandemics on mental health of healthcare workers also found that female healthcare workers usually have higher mental health symptoms during this type of events. Higher concern among females were also reflected in other studies, where women reported better hygienic behavior and knowledge than men. Furthermore, older dentists were reporting lower concern from both sources. And this time, risk perception might not be able to explain such result, as recent study found that age appeared to have no association with risk perception on COVID-19. It is possible that younger dentists might be more concerned because there were less experiences in dealing with new infectious disease, while other dentists might be less concerned as they were more familiar to such a situation, such as if they were in beginning era of HIV infection, which making them more confident in handling with it. However, further study is required to provide solid evidence to confirm this suspect. Finally, the result of this study should be seen under certain limitations of the methodology. First, the study used convenient sampling method and social media to distribute the questionnaire. This might have skewed the sample towards some group of social media users. So our sample might not represent the true population of Thai dentists. And second, we use self-reported questionnaire as a study tool. This means there is a possibility that some respondents were not answering the truth or misunderstood the questions. So it is very important that we are aware of the inaccuracy that come along with the instrument we use. Finally, we now know that Thai dentists were having higher concerns of getting infected with disease from giving dental treatment rather than from daily activities. And younger or female dentists were likely to have higher level of concern, which might also make them more vulnerable to having more stress during the pandemic. Thus, it is suggestive that the government and related organizations such as Ministry of Public Health should immediately provide PPE along with clear guidelines on how to stay safe from such a disease in such a situation, not only in this pandemic, but also in any family outbreak in the future. And that's the conclusion of our study. I would like to end my presentation for now. Thank you for your attention.
Thank you so much, Dr. Athikhun. It's quite an up-to-date perspective in our dental community. So is there any comment or any question from the audience? So I have some questions. This is a self-report questionnaire, as you mentioned. And
Yes.
how could you distinguish the non-dentist response?
Non-dentist response from true dentist response, right?
Yeah.
Okay. We also have a screening question. Let me see if I put it in here. Okay, here are two screening questions. Okay, we have a question that we expect only dentists to be able to answer. These two questions can screen out some non-dentist respondents.
I see.
And also, yes, actually we have rewards for the respondents. We have activities like lucky draw, which require the respondents is personal data. However, the personal data we separated from the data we collect, so the answer still be anonymous. Then we use this personal data to check in the website of sorry,
The Dental Council.
Yes, yes,
The
Thai
Dental
Dental Council,
Okay.
whether they are really a dentist. Yes.
So they have to inform their license number in the lucky draw,
Yes.
and they also have to answer these
yes,
two questions.
Yes, yes, that's right.
I see. And so about the related factors, you mentioned only about the age of the respondent. What about the other factors, like the different workplace is there have an impact on the concern?
Yes, we also did univariate analysis of all of the independent factor we gather, but however, only sex and age show up to have an association with the concerns. Here in this table, show that female have higher concern than male regardless of the source of infection, while another table show that age have relation to the concerns. Other factors such as province that the dentist working in or the workplace they're working in, or and their primary workplace or secondary workplace have no association with the concern.
I see. So it is about only the age and gender.
Yes, yes, that's right.
And about the second part, the open-ended questionnaire.
Yes.
How could you process or analyze the data
or to
in
analyze
this section?
Okay. I because it's open-end question, not a choice, so I have to group the answer into a wide range of topics. Like when, so for example, for the question about what made them unhappy the most during the lockdown, I group the answer of each respondent into group. Actually, they have around over 10 groups. But these three issues showing here are the most mentioned. Yes.
So you can show only the descriptive data and analysis on this section.
Yes,
right?
that's right. Yes, that's right.
Okay,
Actually, this section might not be in our goals, but we decided to also asking this question because we have to we have to distribute the questionnaire anyway, and we think that it is no bad side of having this question, that it might provide us some clues, something like that.
I see.
The time's up already.
Okay, the time is already.
Okay, thank you very much.
Thank you so much.
Thank you very much.
Athikhun. Yes.